Good morning, everybody. It's my pleasure to be here, and I thank you. I thank the organizer for the kind and appreciated invitation. So I will try, in the next, 15, 20 minutes to give you an overview of the project that is called NPAT, that is the Nephrology Partnership for Advancing Technology in Healthcare. But let's start, with numbers. If you can see on this slide where, what is the situation regarding CKD, chronic kidney disease. Look the numbers, 850 million people affected, more than diabetes and cancer and HIV. And we know very well that CKD is becoming a social problem that involves not only nephrologists, but also general practitioners and several specialties. However, a new syndrome is coming out, and is a new nephrologic syndrome, the acute fellowship insufficiency. How can we explain this? 850 million people affected by CKD, nobody wants to start nephrology. And you can see here in the States, more than 50% of residencies programs and more than 30% of positions are going unfilled. So I should say nephrology is not sexy. Why? And look at the situation worldwide. It's, change. In Italy, we are lucky because also, Spain and Greece, Germany, but look at the UK. Very few nephrologists, very few. But also in Italy and Spain, the numbers of nephrologists are reducing year by year. So the global shortage of nephrologists is failing to meet the growing healthcare burden of kidney disease, and global experts predict a reduction in the nephrology workforce over the next decade with potentially serious implications. But what are the reasons? Well, they can be more than one reason. First one, maybe we lack the exposure of our students from the medical school to the field, to the nephrology, and maybe there is inadequate training. Maybe mentors, should we look to the mentors? And there is an erosion from other fields. But, to succeed, we must ensure that those who complete training are highly skilled with expertise that distinguish nephrologists from other specialties and prepare to translate new knowledge into improved outcomes for patients with kidney disease. And one opportunity and a challenge is the interventional nephrology. When nephrology was born, that was in the 60s, 1968, I remember I was a child, my father was doing dialysis. The nephrologist was taking care of the fistula, but right now there are few residents that are on training and there are few nephrologists. So we needed to build a new model, and to build the new model we needed to invest in excellent teaching and mentoring that are the most important factors for satisfaction of our fellows. But more importantly, we needed to establish collaborative networks to revitalize the joy in the practice nephrology and to convince our trainees how exciting and sexy is a career in nephrology. But we needed to go on. We needed an interprofessional education that is the foundation for a new approach to healthcare. Well, the definition of interprofessional education occurs when two or more professionals learn about, from, and with each other to enable effective collaboration and improve health outcomes. So we needed to proceed with a multi-team approach where the nephrologist should be the pivot because we are looking at the CKD patient, but should build up what we call team building with the general surgeon for the PD catheter, with interventional radiologist, with the surgeon, and don't forget nurses and technicians. But we needed also to reformulate our core curriculum regarding the residency in nephrology. We needed to speak regarding pathophysiology of renal diseases, AKI, CKD, renal replacement therapies, randomized clinical trials, clinical pathological correlation, but don't forget the procedural skills. Fellows, residents like to move hands. They want to become expert in ultrasound, in renal biopsy, insertion of central catheters, making fistula, everything that let them become more useful, they say. So we needed to train the next generation nephrology workforce. What can we do? Well, working together. Investing in the interventional nephrology. Let's return to the past, looking at the future. Let's train the trainer. We needed to spend our time with our young fellow. Otherwise, nephrology will disappear. We needed to let the nephrology become a superheroes, as they consider the vascular surgeon, the interventional radiologist, the general surgeon, and we needed to invest in the new trends in medicine, that is the artificial intelligence, augmented reality and immersive reality, simulation and navigation. For this reason, we presented to the European community the NPAT project. What is the NPAT project? It's the first European advanced training course in diagnostic interventional nephrology that aims to refresh the clinical scope of nephrology and promoting the nephrology careers at the European level, to develop a multidisciplinary educational path with patient-centered approach focusing on interventional nephrology, and to foster the knowledge transfer between academia and business sector in order to tackle the risk management in healthcare. What are the methodology? We develop a blended learning path where we are using modern facilities, experienced tutors, cutting-edge simulators, augmented reality tools, e-learning platform, unpublished educational material, live discussion by experts, and customized mobile app. The consortium is represented in these slides, 8 different universities from Europe. You can see from Italy, Holland, Czech Republic, Greece, Spain, and 2 societies, the European Renal Association and the Vascular Access Society, are on board, plus 2 small and medium enterprises, Eureka and EMAC, that are developing the learning platform. This is the distribution of the partners in Europe, and we launched the application submission last year in May, and we started to recruit fellows, so there was a competition. The admission criteria were to be enrolled first or second year of nephrology training according to the candidate's country residency program regulation. NPAT is a complementary training path to the residency program, and NPAT wants to offer advantages for residents to create an international network, to foster the exchange of good practices and knowledge, to acquire transversal and multidisciplinary skills, and finally, to practice with key specialists in nephrology, vascular surgery, interventional and radiology at the European level. We received 87 applications from 24 countries. You can see from all over world, worldwide application, but we could accommodate only 40. So in the second step, we selected 48 candidates that underwent an interview. The average age was 29. There was an international board composed on the NPAT steering committee members. And as you can see, we have on board now 40 students, 40 residents, 31 females and 9 males. The program, 4 curricula for 40 young nephrologists. We call them REMAP, REVAC, REMUSE, and REPED. The REMAP is enhancing the approach to renal biopsy by leveraging the latest advance in histopathology and molecular pathology. The REVAC provides comprehensive knowledge in vascular access management, resulting in a more effective, efficient, and safe patient treatment. REMUSE describes the fundamental principle of the ultrasound techniques and the application of the ultrasound to the main topics of nephrology. And finally, REPED will focus on providing skills in peritoneal dialysis management and surgery techniques for correct catheter placement. This is a 2 years programs. Each module lasts 6 months, and there is a theoretical and practical part. 2 modules were already done. The REMAP module is started August 2021, was on renal biopsy and renal molecular pathology. We developed an e-learning platform where, the residents could, follow the lessons, and they found on the platform. And there were, hands-on training, one of renal biopsy and the other one of digital pathology, 24 hours plus 18 hours. So 4 days course for renal pathology and 3 days course for digital pathology that were, spread in Europe, in Milan, Ljubljana, Prague, Bari. And unfortunately, due to the COVID, we couldn't, make Amsterdam, but we did it, in digital pathology in a digital meeting. That was very well appreciated. This was, the schedule on the hands-on training for renal biopsy agenda for 4 days, full immersion, I should say. You can see, we use the most, updated technologies that are, on the market. So the fellows come, in, and they stay with tutors, and they meet, the patient, but they use also phantoms or mannequin, to be trained. So they started with mannequin and with the phantom, and after they go on the patient. I was, tutoring, you can, appreciate in these slides, I was tutoring for renal biopsy, the fellow. They, started with the ultrasound, how, to use the ultrasound, how to recognize, the pole, the kidney pole. I taught them, regarding the different techniques that you can use in renal biopsy. You can see they were using also virtual reality, trying to understand very well, the anatomical parts, but after they started in doing biopsy on a phantom that had inside a pig kidney, a real pig kidney that, as you know, is very similar to the human kidney. And we tried, to teach them how to do it, how to recognize the pole, how to do the renal biopsy before the tutor and after, the resident. and they were doing very well, sometimes, better than the tutor, because they were very excited, look at that, he's I think from Polish too, he's from Poland, and so they were, everywhere, and they were young, and since, I'm becoming old, it's very nice for tutor, being, challenging in doing everything that they are able, to do it. And we brought them in the surgery room. We are lucky in Bari because we have a building dedicated to nephrology, and we have our surgery room inside. So it was nice, to bring, the students inside of our surgery room, and they did the biopsy with us. We trained them how to do it. This is a SALP position. We do in Bari several positions for biopsy, the SALP approach and the prone approach. So we are able, to do also difficult biopsy, because not always is easy, especially in obese patient. I was, seeing Tommaso, that was showing us, a new technique, for a new puncture in the obese patient. So we are, able to do biopsy in SALP position, in prone position. This paper was published on NDT long time ago. And as you can see, she's a resident that for the first time was doing biopsy. So she followed me. She was trained to do it because they were authorized, because they needed to do it by hands. Because if you don't do by hands, you don't learn. So we needed, more tutors. They should get them the needle and doing the biopsy. Otherwise, doesn't work. Fellow needs that we do together, we work together, how to do it. Renal biopsy, vascular access, peritoneal catheter placement. In my place, we do everything in interventional nephrology, from renal biopsy to look at, the fellow. She finished the biopsy together with the tutor. The tutor should, let the fellow do it and learn, regarding how she was doing. So, but they had also, they made it networking. So they enjoy, staying together. They were everywhere. They were working hard during the day. At the night, they spent time together. And regarding the agenda of digital pathology, very complete agenda, a very nice training on digital pathology. And there was a very important meet the expert. The meet the expert, there were, specific question, for example, which is the workflow to perform a molecular diagnostic analysis in patients with suspected gene mutation, and there was a lot of discussion of it. And regarding the REVAC module, this was just finished, was also, they were very enthusiastic in doing vascular access approach. These are the e-lectures that we have it, and this was the training. The residents were trained, in Milan, in Barcelona, in Maastricht, and in Bari, 18 hours plus 24, because there was a basic agenda of 3 days plus an advanced agenda on 4 days. So the residents spent 7 days in the training centers, and as you can see, also in this case, cutting-edge technologies, phantoms, mannequin, virtual reality, real patients. They want to see real patients. They needed, to stay with patients. They needed to understand what we do with our patient. And for example, for the REVAC, and I'm almost done, another minutes and I will conclude, in which situation it is better to place draft rather than an AVF? Or is there a significant difference in the infection rate between tunneled CVC compared to pre-cured non-tunneled catheters? And is starting now the REMUSE. REMUSE is ongoing, and in January with 30 hours of hands-on training, and in January 2023 will start the RIPED, that is on the placement of peritoneal catheters. That there will be 24 hours of training in Bari, in Patras, in Sabadell, in Maastricht, and in Milan. So, concluding, NPAT impact. Well, the NPAT will release an e-learning platform that will have an open access, but most importantly for our fellow, they will receive an academic certificate with 29 credits. NPAT's goal is to make nephrology career more appealing by creating a community able to engage thousands of nephrologists worldwide, but most importantly, NPAT, the educational model, wants to share knowledge as key for the future of nephrology. And I thank you for your attention.